Hi everybody, and welcome to the news from the ANU Medical School from today, the 22nd of May. I was interested to see the former US President Barack Obama's graduation speech last week. And taking the political innuendo aside, there were lots of points in there that really spoke to me, and I'd just like to share them with you and see what you think. Former President Obama said, "The old ways of doing things may no longer work. We need to be innovative. Don't be afraid to try. Learn from your mistakes. We need to think beyond ourselves. We need to think about each other. Honesty, hard work, responsibility, fairness, generosity, and respect for others are values that last. And be part of the solution. Build a community and work together." I think nowadays, during the coronavirus crisis, these are all values that I very much reinforce. And I think particularly that thought that we not just have to protect ourselves, but protect others, our community, and work together is something that has really come to the forefront. And these words really spoke to me, and I hope you like them too. So let's get to the answer from last week's quiz. The photo that I showed you was that of Professor Peter Keimer. There was a hint in the picture behind me because there was a picture of hand rub, and that was the connection to coronavirus these days. Professor Keimer is a Hungarian who fled Hungary in 1956 after the uprising against the Soviet Union, studied medicine in Germany, and became the chair of cardiothoracic surgery at the University of Hamburg, Germany. His claim to fame is that he developed with the company Bode and Company Sterilium, which is an alcohol-based hand disinfectant. In those days, surgeons would scrub their hands before surgery, and on the wards they could either use high percentage alcohol to clean their hands or some washing solution that really wasn't any disinfectant. And he was interested in developing something that was gentle to the hands yet would kill bacteria. He had a friend, a chemist, who happened to work at this company, and with his help, Sterilium, which nowadays is still a range that is used in Europe of hand rubs and hand disinfectants, was developed. Congratulations to the winner, Bella McGovern, who was very quick in coming forward with the answer, and I'm interested to see what this quiz brings for you for this week. So in this week's quiz, I am giving you a few hints here. This gentleman here on the top left shares the same name with the person I'm looking for, but he was knighted, and our person hasn't been knighted yet. The hints are psycho killer, AFL, and bugs, and I'd like to know, who is this? Where was or is he working? What role does he have? And what's he most famous for? Please email me and I'll announce the winners of the quiz next week. You would have seen on the ANU website, and I think on my video last week, I talked about the ANU's plan for the return to campus. Now things are becoming a bit clearer, and you can find instructions on the ANU website. For us, what that means is that the Florey building will be open from the 2nd of June, but only for staff. The TCH and Calvary campuses will be open for staff from the 2nd of June, and for students only after the 8th of June. Phase 1 students won't be returning to campus for a few months, and I'll give out more details once we have them. But Phase 2 clinical skills teaching will commence after the 8th of the 6th for the Year 4s, and 28th of June for the Year 3s. So what has to happen for staff and students to return to campus? For staff, please talk to your supervisor about your plans to return to campus, or whether it would be more convenient for you to continue to work from home or do a hybrid of both. You will have to do the COVID-19 online infection control training that's found on the Department of Health's website, the Workplace Health Safety Checklist. You will have to fill out a risk form that we will make available to you. And please either download the COVID Safe app or maintain a diary so that we are very clear whom you've been in contact with, just in case somebody is found to be coronavirus positive, and we can do some contact tracing. There are more details around cleaning your desks and equipment, and where you can sit and how many people can be in a room, and we'll make all that available to you. For students, I urge you to also do as much as you can at the moment. You will also have to do the COVID-19 online infection control training. Please do that now. Upload it to Sonia. You've all should have gotten some information through Wattle from me. You will not be able to do the clinical skills teaching without this online learning. We will make a risk form available to you as well that we will also need to see uploaded. Also, please either upload the COVID Safe app or keep a diary. And I think I have made it clear to everybody now that you will now not be excluded from any further clinical placements if you've travelled interstate. In the HDR arena, you would have seen maybe on the medical school's website that there are stories on some of our HDR students. Satasa is one of our HDR students, PhD students, who's an HIV physician, who gives us some details on his research and why he's come to ANU at the medical school to do his PhD. Carly Johnston is well known to most of you. She's a pharmacist and the head of our pharmacology teaching in the MCHD program, and she talks about how to take one baby step at a time when doing a PhD. Mohammed Shamoon is also an HDR student from Pakistan who's really just arrived before the borders were closed, and he talks about how he's managed to approach his research by shifting his research activities. Please have a look on our website, and I'm sure all three of them will be happy to answer questions and for you to contact them. So we've seen Associate Professor Vanessa Johnston, who's an Associate Professor at the medical school, but also the Deputy Chief Health Officer in the media this week. She is talking about challenges of responding to the COVID-19 crisis on a range of podcasts. Dr. Anna-Greta Hunter, who's also a medical school academic, and Professor Russell Gruen, who's the Dean of the College of Health and Medicine, with two other researchers from the College of Health and Medicine, have published a commentary on heat-related mortality and urging us to rethink death certificates to find more data on mortality that is related to climate change, particularly heat. This is in the Lancet of Planetary Health if you want to read it. On other news, the internship survey, which is a survey that's been running for 3 years now as a collaboration between the AMC and the medical board, asking interns how well they feel prepared by their medical school training to do the job as a junior doctor, will clearly not happen in 2020, because which medical school can prepare a junior doctor for a worldwide pandemic? But what will happen is that there will be an analysis of the 2017 to 2019 surveys with some focus groups as well, and we're involved in this and we'll be interested to see not just what the data has shown over the years, but particularly what have medical schools done to change their curriculum to address deficiencies or to really celebrate what they're doing well in preparing junior doctors for their job. At the college, you may have seen an email that the split of both colleges, the College of Science and the College of Health and Medicine in certain areas will happen in June, and one of the steps that had to be taken by our college is to appoint a general manager, and Donnell Claudianos has been appointed as the interim general manager for 12 months. Congratulations, Donnell, who's been really doing a great job in being the general manager for both colleges over the last few months. We had to notify the Australian Medical Council on the changes that we had to do during the coronavirus pandemic to our teaching program, and we've just received a letter telling us that our changes were entirely appropriate and we continue to meet all standards. And in ANU campus, as you can imagine, the discussions are a lot around the budget. What will the budget be for this year? What are the expenses? And what budget models will be used and what money is available for the next few years? And there will be some changes around delegations and some control of expenditure. So this is all from me for this week. Please remember the rules around coronavirus. Although we do not have any cases in the ACT, it's important to continue to stay home if you're unwell. Please follow the testing guidelines if you think you need to be tested. Wash your hands, maintain social distancing, look after yourself, but particularly look after each other as well. Feel free to email me with any ideas, any concerns, any good news, and I hope you all have a great weekend. Thank you. See you next week.